Okay. Hello, everybody. My name is Prashita Vora Shah. I'm here with Dr. Shilpa. Today, we're going to be talking about diabetes and foot care at White Oak Medical Center. All questions related to diabetes and foot care. How are they related? What's going on? Dr. Shilpa has the clinics with us every Thursdays from 8:30 to 12:30 at White Oak Medical Center. She's a diabetologist specialist. Dr. Shilpa, over to you, please.
Hi, everyone. I have a special interest in diabetes only because that it has become such a common part of our everyday life. There wouldn't be a single family around that does not have at least one individual with diabetes. And having said that, I think the current generation of children and young adults, as well as elder adults, all are at high risk of developing type 2 diabetes mellitus because of the kind of lifestyle that we live. And of course, now it's COVID time, so our activity has come down, our diets have changed. And having said that, we're all at risk of type 2 diabetes mellitus. And like Prashita mentioned earlier, prevention is any day better than cure. So we did talk about diabetes with regard to prevention or reversal of diabetes. We touched up on it about 2 sessions ago. And today we are going to talk about something that's very least talked about because we end up missing it. So we end up using our feet for whatever it is, except for sleeping. But even when you're sleeping, you want your feet nicely tucked into the blanket, especially in this weather over here. So that itself is going to keep you warm, obviously. Feet are an integral part of your body as much as we love to ignore it. I don't see many people taking extra care into foot care as such. They don't look at their feet. You wake up in the morning and you look at your face, you wash it, you brush and you comb your hair. Most of us do at least. But then how many of us actually look down and take a look at our feet and see, okay, how are you guys doing down there, And I think that's something that's extremely important. Ladies do take care of their feet through manicures and all of that, but that's not all of the ladies. It is some who are more concerned about these things. But other than that, I don't see many of us taking care of our feet. I'm not sure if I can see the comments, but is there anybody who actually takes good care of their feet? Is there anybody over here who actually looks into that? Prashita, are you getting any comments? No, right?
Not yet.
Okay, no problem. So that's the thing with feet. In an individual with diabetes, you're going to have a 25% chance of developing a foot problem at least once in your lifetime. And that problem, once you develop it, there is a risk of it recurring. One. Second, it increases your risks of hospitalization. Third, it worsens your probability of developing a cardiac problem. So you ought to be extremely cautious about how we deal with foot problems. So are there any questions so far? Do you want to put anything together? Is there anybody with any questions?
I have a question.
Okay.
What is so worrying about foot care when it comes to diabetes? What is the correlation with it?
So diabetes is a chronic lifestyle disorder, and the long-term consequences of diabetes is that the arteries or the blood supply reduces, and the nerve function reduces anywhere and all over the body. With regard to even your stomach, your brain, all of that gets compromised if the blood sugars are on the higher side for a longer period of time in an individual with diabetes. With regard to the foot alone, the nerves of our feet not only allow us to feel sensations, like when we get a pinprick, we have a tendency of pulling up, right? You step on a Lego, if you're a mom, you'll understand, or even if not, you step on a Lego and your initial instinct is ouch, and you reflexly pull your foot away. Am I right? So in that same way, that sensation is a protective sensation. Why? Because it prevents your foot from getting injured severely. When an individual with diabetes has one, long-standing diabetes, two, high sugars, and there is a difficulty of nerve functioning during this time, the assessment or the degree of the injury that can happen may be a little bit more because we are not able to protect ourselves. So that protective sensation not being there we end up not being able to retract our foot off soon enough, and we end up getting deeper injuries. Thorn pricks, nail pricks, bad footwear, all of these are things that predispose to wounds. And now, because although maybe even the sensation may be disrupted a little bit, on the other hand, the blood supply may not be good enough. So the soldiers of your body that are your white blood cells may not be able to prevent infection of that particular wound and will not allow for healing process of that particular wound. Those two combined, the nerve disruption as well as the blood supply disruption, cause severe problems to the feet, especially because they're the farthest away from the heart. And these are what predispose to non-healing wounds in the foot. Not every individual with diabetes develops injuries that are non-healable. Even an individual can, with good control of blood sugars, can develop an injury and can heal very well, very fast. But the longer standing the blood sugars have, or the diabetes, or the longer standing the sugars have been on the higher side, the worse the chances of non-healing foot ulcers. And it doesn't even have to be an external injury. It could be a simple footwear issue, wherein, or there could be a change in the foot shape that can cause all of these things. And those are what usually give predisposed to your now diabetic foot problems.
Oh, okay.
And when you have a foot ulcer, your chances of cardiac problems increase. There has been a correlation found, because that just tells you, when you get a foot attack, a diabetic foot attack, that the sugars are not well controlled enough and something needs to be done, and that you're going into complications that are now reflecting in your body.
Okay. My next question is common problems that are more dangerous in an individual with diabetes.
Okay, so a lot of us do develop bunions. That is where if the foot is like this, if you're considering these to be my toes, and this to be the upper aspect of my foot, and this is where we step, right? We call it the plantar aspect of the foot. Sometimes that you will have noticed that the bone on this side, right after where your toes join your actual foot, this part will be a little pointed out. It'll be a little bit more data or crooked. So this part is where you develop bunions and other deformities, wherein sometimes your foot can become flat or your foot can become high arched. And where the pressure points are unwarranted, or where there are new pressure points that developed, is where now we have diabetic foot ulcers. In an individual who does not have diabetes, you will find that, oh, that hurts. So you're going to go to the doctor sooner and you're going to get it fixed. Now, when there's diabetes, there's a reduced sensation and there's reduced blood supply. And of course, along with the nerve supply for sensation, the autonomic nerve, that means the function of the nerves that preserve the moisturization of the feet and the healing of the feet and the warmth of the feet, all of that gets disrupted. So the patients do not come to us soon enough. And even the architecture of the foot changes. And therefore, we have these problems. Another thing, apart from bunions and other architectural problems of the foot, you have nails. Everyone has nails. And a lot of us have ingrown nails, wherein the nail doesn't grow upward and correctly. It actually digs deep within into the soft tissue or the adjacent to the nail bed, into the nail bed. And those can create secondary infections. Another thing is many of us do go swimming, or many of us work with water. In some places, there'd be farmers working with water. Some of us wash dishes all the time, and our hands or our feet are consistently wet. And commonly, there's fungal infections between the toes or between the hands. Yeah. It's very, very common in housewives, in individuals who are working in watery places. And well, while in an individual who doesn't have diabetes, it may not cause much of an issue. It may cause some itching and it may be easier to manage. But with regard to individuals with diabetes, because they don't look and there's not much of sensation, so there's not much itching, these infections then become secondarily infected with bacteria and cause swelling, pus accumulation. And therefore, these patients are at higher risk of developing amputations because of that infection there. Because why we go in for amputations in diabetes is one, because of very severe infection, and the toe or the digit or half the foot or the entire foot needs to come off so that the rest of you can be saved, your life can be saved. Or the other aspect is when it's non-functional, wherein the toe now becomes broken within and the bones become shattered because of the infection, and that does not serve any purpose, and sometimes we need to remove it because of that. And other things are because of gangrene. Gangrene is one thing that many of us know about. There's wet gangrene, there's dry gangrene, and many of us know that it's associated with discoloration or darkish color of the digit maybe. But then many of us don't know that we can actually prevent this. And these are the common things that we come across. And why I want to focus on diabetic foot care as such from a diabetologist point of view, wholly and solely. I'm not a foot surgeon, I'm not a surgeon in general, but I believe that all of us have the right to an education to diabetic foot care, and we all need to take care of our feet very often, right? So these are the common foot problems wherein I may not have diabetes yet, hopefully. I'm not checked. And I do take a look at my feet every day. Apart from taking a look at your feet every day, common problems like shoe bites that we call. So you buy new footwear, yeah, and you're excited about wearing them. Individuals with diabetes may not have that much of sensation, and they may end up missing a shoe bite, which will now become an extensive wound, and they may not even notice it because they're not looking at their feet. Yeah. So common problems can turn very dangerous in individuals with diabetes because of the nerve disruption and because of the blood supply disruption.
Okay, so I've seen like a bunch of people with in between their toes, there's like a yellowy discoloration going on. That's related to diabetes, I'm guessing, right?
It's related to a fungal infection that can happen to any one of us, depending on how well our feet are moisturized, cleaned, neat, and tidy and hygienic. Now, one thing that we tend to do when we go into the shower is go wash ourselves. We don't dry our feet. We don't dry our feet between the toes. We just assume that it's going to dry up. Individuals with diabetes must make sure that the in between of the toes must be dried correctly so that there isn't much of moisture that remains within. Okay, and that's the thing. That's what we have to be very cautious about, because those can predispose to fungal infections, the yellow or the white stuff that you're talking about between the toes, and that can cause a lot of problems in individuals with diabetes. And it's very common. It's called athlete's foot, and it's very easily treated in the early stages, but then later on it becomes very difficult.
Oh, okay. My next question, thank you for that. My next question is risk factors for developing foot problems when one has diabetes.
Okay, so like I said, I cannot stress enough that long-standing diabetes and poorly controlled diabetes is a very major risk factor of developing foot problems. 1 in 4 diabetics are going to develop a foot problem at least once in their lifetime, and it may be severe if it's not taken care of in an early stage. So first of all, get your blood sugars checked regularly, and make sure that there is no smoking, active or passive. Now, individuals who are even exposed to passive smoking have been found to be at high risk of developing blockage of the arteries, or what we call peripheral arterial obliterative disease, wherein the blood supply to your feet are disrupted. And even if you don't smoke yourself, if you're in an environment frequently that is associated with passive smoking, your spouse, your friends smoke, that can affect you. And so you have to be really cautious about it. Smoking, neuropathy, like I said, nerve damage, barefoot walking. Now, many of us do tend to do a lot of barefoot walking, especially within the house. It's the right footwear, even within the homes. So how do you select the right footwear for a home? When you have a slipper that you're using at home, make sure that you're able to at least compress to at least half of its softness, not completely and not at all, but it should compress to at least half of its insole, the sole, the rubberiness or the softness should be that you should be able to compress it to at least half its breadth, not less, not more. So that's when you know that your footwear is good. and it will support the pressure that is on your feet from your entire body, right?
Right.
And there's a lot of footwear that is easily available with regard to anybody who was diabetic or not diabetic. And it's extremely important to not wear do barefoot walking in the house. Another thing is that we do not moisturize our feet well enough. I'm not talking about getting your foot creams and all of that. It's just about basic moisturization, using any cream and taking a look at your feet on a daily basis and making sure that it's not completely dry. And if you do have cracks, you can do soaks of water and a little bit of salt and try to do a bit of pumice stoning. But when it is beyond, or when you find that there is redness in the foot, please do not manage these things on your own. Since I'm talking to a population that is largely Nairobi, we have a podiatric surgeon here who is excellent and who is extremely dedicated to especially diabetic foot-related care. And Dr. Collis can help you out with that. Please do not go meddling with foot calluses and corns and trying to put corn cap over it unless somebody has actually seen it and advised that to you. A lot of us see things on the feet like boils, blisters, and try to tend to pop it. So instead of doing that, please have it seen by the appropriate individual and make sure that that gets sorted out correctly. If you do not know whom to go to your physician or go to your diabetologist and get your referral, because these things need to be physically examined first and then intervention needs to be done. So it becomes very, very important to do something like that. You cannot just pop boils, blisters on your own and then expect it not to get infected and get into difficult situations. Being overweight or obese is a high risk factor for developing a diabetes related foot problem. Working with a lot of water, like I had mentioned before. And those are pretty much the high risk problems. Your shoes are extremely, extremely important in this.
I have a question. Before we open the floor to everyone, if anybody does have any questions, if you could please type it in the box below, in the chat box. Question to you is, what about people that are living in humid climates? What happens there?
Okay, so individuals living in humid climates, again, it becomes extremely important for us to make sure that they wear maybe open footwear where possible, where feasible. Now, having said that, not many of us can wear open footwear to work. It is mostly closed shoes and socks. The socks that you must select should be purely cotton socks and not nylon socks. If you're getting wearing stockings to work, again, preferable to use pure cotton stockings so that even whatever moisture forms or you sweat within, at least it gets dried off with cotton rather than with nylon that can then retain this moisture, and that will predispose to your fungal infections, especially between the toes. Yeah. And when it comes to humid weather, again, you come out of work, you come home, wash your feet with normal tap water, with soap, and then dry between the toes. Make sure you dry between the toes. That's a very important thing. After that, make sure you moisturize with the moisturizer and make sure that there's not too much moisturizer that now remains between the toes, because again, this is going to predispose to fungal infections. So just about enough moisturizer, not that it's oozing all over, just a little bit to make sure that your feet are not dry, visibly dry. That's extremely, extremely important in humid weather.
Okay, thank you. We're opening the floor to anybody who wants to ask a question. If you could please type it onto the chat box.
Until then, I thought I would actually, we have Lillian here. She is the staff of White Oak, and she quite graciously volunteered for me to show a bit about what to look at when it comes to foot care and how you would want to look at your feet if you're an individual with diabetes or even otherwise. So excuse me while I move up. Thank you, Lillian. So these are Lillian's feet and they're beautifully manicured.
Okay. Could you point it down a bit? Yeah, there you go.
Yes. Okay. So these are Lillian's feet, and we are going to take a look at what exactly we look at. When you look at your feet every day, as an individual with diabetes, or if you have an individual who has diabetes in your home, you're going to take a look at the feet. Now they're moisturized enough. There's no dry skin. You can even scratch and see there's no line that remains. So you know that they're moisturized enough. You're going to feel the temperature of the
back of the temperature of the feet with the back of your fingers or your hand like this. And you're going to compare it with a little higher up. If you find there is a warmth, you must see a doctor. Another thing is that you're going to look between the toes like this, okay? These are where the fungal infections now usually set in, right? And this should happen at least once in a week or once in 3 days, if not every single day. Followed by that, we're going to take a look at the undersurface of the foot here. Right? You're going to take a look at the undersurface of the foot, and you're going to see individuals with diabetes tend to have foot ulcers in this specific area. Can you see, Prashita? Can you?
Yeah.
Yeah, yeah. So in this particular area, okay, and in these particular areas, at the back, at the bottom of the foot over here, near the crack, okay? And this is very high risk, and this is where bunions develop generally, and this is where you end up having foot wounds, especially if you wear closed feet and they're very tight. Another thing is we women tend to wear is heels or footwear that has a conical or a sharp shape in the front there. I don't know what they're called. Prashita, have you any idea what they're called?
I just call them pointy toes.
Pointy toes, that's the one. So avoid wearing shoes like those, because then what happens is the feet get completely compressed like this, and that predisposes to this kind of a shape. Lillian's feet are fine, don't worry, Lillian. But then when it comes like that, the architecture of the foot changes and you end up getting wounds on this aspect as well as this aspect, right? Another thing is when we wear footwear or buy footwear, what we end up doing is go early morning on a Sunday and just pick up footwear whenever you want to. That's not the way we do it. The best time to wear footwear, according to even Dr. Collis, has always told this to his patients, and I respect that. He always tells the patients to buy the footwear around 4 p.m. in the evening, and it should not be very snugly fit, nor should it be loose. Now, another thing that we tend to do is buy tight footwear and think that, okay, we are going to wear it out and it's going to fit eventually. But that's not the way it is. Generally, what happens is it ends up remaining tight, and we don't, we end up getting shoe bites, or we end up getting wounds because of that. And that's not safe, right? And that's another, okay.
Why at 4 p.m.?
Because that's the time when your feet are a little swollen after the entire day. And therefore it will be just the right fit for the rest of the day as well.
Gotcha.
Okay, so you've walked the whole day, your feet are slightly swollen, just a little bit. And so you will end up wearing snug, okay fitting footwear. You will not wear something that, you will not buy something that now will become tight for you in the evening. If you buy footwear in the morning, by the time it's evening, your footwear can become a little tight, and therefore you want to avoid that. Yeah. So when you buy it around 4 o'clock, it will be just a perfect fit. Gotcha. Yeah. Another thing I wanted to mention about the toenails is when an individual with diabetes has, like, of course, we all have toes and nails. The idea is not to cut curved like this, but just perfectly as to how Lillian, can you see, Prashita, is it visible or is there too much light?
A bit too much light, but it's okay. So straight.
Okay. So one has to file the nails straight so that the edges are sticking out like this.
Okay.
Right. Okay, hold on. Yeah, this is better. So you can see that the edges are sharp on this side as well as on this side, right? Okay. And they have to be filed straight across and not cut in a curve like we generally do, like with fingernails, like, yeah, something like this. This is bad. Okay, you have to cut it straight across exactly like this. Not cut, you have to file it. All individuals with diabetes would be better off with straight filing nails instead of, because if not, that predisposes to ingrown nails. And we want to be really, really cautious about that. And that's pretty much it. Another place, people who pray with their feet under their hips or cross-legged. So a lot of people sit cross-legged. This is another place where we can develop foot ulcers, or even individuals who kneel or tuck their feet under their buttock while they pray. The foot ulcers can also develop in these areas if it's chronic. When you feel your feet, you should be able to feel it as very soft. In any place, if there is any kind of, what do we call it, hardness, we ought to, thank you very much, William. So we ought to now
get that shown. Don't sit and scrape it with a pumice stone because you feel like it's going to go away. You have to show it to somebody like a podiatric surgeon for them to tell you what exactly to do and whether anything is needed at all. We have the right tools to be able to scrape it off, but medically and safely, not just anyhow. Okay, blisters are something that are something that is also very common in individuals with diabetes, and in which case we need to be very cautious. Do not prick it. Just get it shown to a doctor. You might need a bunch of antibiotics, not a bunch, just a course of antibiotics, I'm sorry. And that itself would be very helpful rather than poking it, causing an active infection. What we do is